I am actually a graduate of NYTCOM. So we had rotations all over as a medical student. And then just so you know a little bit on my background, besides being on the Board of Governors and in charge of the membership committee, I'm an anesthesiologist at Stony Brook Medicine, which is out east on Long Island. And I have a concentration of taking care of OB anesthesia patients and urogyn patients in the main OR. So if you have an interest in those areas too, feel free to ask about that. But for those of you who's starting out just on your rotation, so maybe just finishing up second year, so you'll be going out onto clinical rotations very soon. So very, very important to be prompt, of course. So professionalism is key, right? You want to always be on time. And all of you were right here on time, so that's perfect. Great start right here. Be aware also of sensitive and cultural barriers. So being in New York, we have a lot of different cultures that we encounter, right? So many people don't even speak English that I take care of. So we may use translators. We may have women who don't want to have male providers. So if that happens to you, don't be upset. So for those of you who are male, you just have to be respectful to all patients, really. So usually you could find another provider in that case, because, you know, according to their religion or according to the culture they're in, they may not want to have men taking care of them. So all these things come into account. So you have to realize that and be sensitive really to it. I think we had a couple of questions that came about on professionalism too. So that's always a good topic. You always want to make a really good first impression with everybody. You want to take responsibility for any of your own actions, right? So if you have an encounter with anybody and it goes, you know, sideways, you do want to make sure that you rectify that. Always tell your resident, your attending that you're working with, anything that happens. Show integrity, right? Commit to self-improvement, right? So if you don't know something, look it up, right? So if you're asked something on Monday and you come in Tuesday and they want to know about, you know, congestive heart failure on this patient and you just weren't sure about it, so look it up. So that way you come back the next day and that attending, when they go around and do rounds with you, you'll be able to answer those questions, because a lot of times they start with the medical students, right? So you guys get the first questions, and then the residents, the interns before that, then the residents will get questions. So if you look it up, it shows that you are interested more, right? And if you come back the next day and give, you know, all the information that you learned about it, it shows that you really, really have a true interest, genuine interest, and that you want to further your knowledge. So that's really important too. You also want to dress appropriately, right? So if you're on clinical rotations, right, and you're out in the office, you want to look, you know, like you're in the right place, right? So you don't want to come in your ripped up jeans. You don't want to come in your tank top, right? So you want to dress up for that occasion. Of course, if you're in the operating room, you want to be in the scrubs. Different areas have different scrubs, right? So you want to be aware of that, and you want to have the correct ones, because then you can kind of get in trouble. You're not following sterility, right? So very, very important. Also, a lot of places do not let you take the scrubs outside of the hospital. That's a rule in our hospital that I'm at. So that would be a no-no. If somebody saw you, you know, wearing the operating room scrubs out, that's really poor professionalism, right? So you want to, you can wear the other colored scrubs, but not the operating room scrubs, right? So if you came in white scrubs and they use green scrubs in the OR, that's perfect, right? You could do that, as long as you give them back at the end of the day. So very, very important. And feel free to stop me if you have any questions also along the way. I'm going to be checking the chat, and I just see a lot of schools so far. So awesome. I see we have NYTCOM, LECOM, we have TUNCOM, right? LMU, a lot of new ones, right? Idaho College of Osteopathic Medicine, ASCOM, very nice. We have all over, UIW, SOM, and Unicom, all over. So very nice. I think we have a good mix of everybody. So also interaction skills are very important. So you want to communicate well with faculty. You want to communicate well with other trainees, right? And you want to communicate well with the healthcare staff. Also with the nursing staff that you're with, and other personnel, everybody that you encounter really, right? So I always say it's very important to introduce yourself, especially in the operating room, because we're all wearing scrubs. A lot of times it's hard to see our names, right? If you don't have it right up, the name tags. And if I have somebody that just comes in and they're working with me, and all of a sudden they just want to do something, and I don't know, are they the housekeeper or are they the medical student, right? So you have to introduce yourself wherever you are. You know, if you have new people that come in with you in the room, always introduce yourself. I'm medical student, you know, Michael. I'm going to be working with you today, just so we know, because a lot of times we have a lot of people that are with us during the day. You also want to establish trust and rapport with patients. For me, being an anesthesiologist, we have a very short period that we encounter people. They're very vulnerable during this time, right? They're coming in scheduled cases or sometimes emergency cases. And we have just really a short period of time to get to know them, get their medical history, and get that rapport, right? So they feel comfortable with us. That we're going to be taking care of them and establish that trust. So you have to do the same thing as a student, and always say that you're a medical student, a fourth-year medical student, a third-year medical student, because they need to know, right, who is on the care team taking care of them. Because a lot of times, a lot of patients have a misunderstanding. A lot in teaching hospitals, they don't realize there could be medical students, there could be residents who are learning. And if they're not aware of it, you know, they do become aware of it when the attending gets to them, but you should start also. So that way, as you know, each person meets them, you guys are usually the first ones, so they will know. You also want to demonstrate compassion and empathy. Be very sensitive, you know, in patient care too. It's very important. Because like I said, patients are coming in, they're very vulnerable at this time. Be motivated, also take initiative. So whatever you do, you know, you want to get out there and do it with, you know, 110%, right? So if you looks like we need help in the room, it's great to have a team player in the room, right? If you're just standing there on the side and we're doing all the moving and everything, there's a lot of things that happen when the patient first comes in the operating room, right? So they have to move over from the stretcher to the bed, right? And we could use your help, right? So and definitely, you know, very easy things like that. But sometimes it just takes an extra couple minutes, right? If you don't have the right helpers, right? And patients can't move as well, so it's great to have you guys helping us. Put on your gloves, be ready to help, introduce yourself. I'm medical student Michael, I'm here to help you. And then, you know, we'll either direct, or if you see that, you know, that you're needing help, right? If there's only 3 people to move the patient, we need a 4th person, right? So definitely volunteer right in to do that. When we're leaving the room, also, it's great to have somebody help us with the foot of the stretcher, right? So just to help steer. A lot of times these beds are very big and bulky, and if we have a lot of IV lines, a lot of drips going, it's great to have somebody helping steer at the you know, the foot of the bed, because we're watching the lines, we're watching the monitors, we're watching the oxygenation. So a lot of, you know, things happening, you know, so it's good to have somebody help us always. If there's, you know, anything, a sterile procedure going on, you should put your sterile gloves on too. So be ready to help with that too, right? So because you'll miss out then, right? So if we're doing an epidural or we're doing a central line, if you get your sterile gloves on too, you're more likely to get volunteered into helping us, right? So, but if you don't have your gloves on and we have to wait for that, you know, then then it's an issue, because we're also trying to do things in this age not so slow, right? So we have to keep moving, because operating room time, is money too, right? So we don't want to waste a lot of time. So we try to do things as efficiently and as quickly as we can. And the little things, even just putting on gloves to wait for these things, sometimes it takes long. So it's good if you have them on to start. Also, for clinical skills, this will come with time. I don't think you should, worry, especially when you're first starting your rotations. Even as fourth years, you will get the experience doing different rotations. The main thing, when you're first starting, is you want to have good competency with history taking, doing the physical exam, develop a problem list. So you'll have, when you're doing medicine, you have a whole lot of patients that you're taking care of. So each one is going to have a problem list. Each one is going to have a differential on what's going on, right? So if you can demonstrate good decision making and how you're coming to conclusions of it with your team, that's great. You're going to stand out that way too. You also want to accurately reflect the patient's information on the record. If you have access to electronic medical record. Some people had asked questions before, if you don't have access to electronic medical record, what do you do? That happens at some places. Some hospitals won't give medical students that access. So what you can do, what I recommend in those cases, is you pair up with the intern, pair up with the resident when you're working with them, ask them what time they come in, right? They come in at 6:30, you come in at 6:30, right? Because now you won't have access to the record unless you're with them. So if you're basically their shadow, wherever they go, you'll be seeing when they write their notes, when they look up information on the patient. And it's just a little, sneak peek into it that way. You're not getting to actually write your own note, but you can see how it's done that way, and you can get the gist of it that way. You also are going to do presentations as you move along in your medical career also. So when you're on rotation, you may be asked just to present to patients, so that's kind of informal. And then you may do, big grand rounds even. A lot of times the students will get volunteered into doing that. We had an interesting case. Why don't you come to our grand rounds and present that for our department, right? So when you do that, of course, you want to have all the references. You want to look up what's important about the patient, just like you would present it, but you're going to elaborate even more. And that will definitely make you stand out, right? So you've done the work, and you've done the research, and you can quote the references. That will make you look very good during it. You also want to demonstrate for clinical skills, effective patient care, and then follow up, and then patient monitoring, right? And problem monitoring. So these things will also come with time. I wouldn't be too concerned if you're not sure about, getting the full differential first. You can look up these things too. So you can do is know the patient, right? So this is something very important to help you shine during your rotations, right? You can come even earlier than the residents, right? And if you know, even earlier than the attending, right? So if you come in and you know everything about the patient that morning, I'll give you an example for operating room, but it goes for anything, right? So if you know what their labs were that morning, if you know what their EKG was that morning, if they had a chest x-ray done, if you know all these results, you are definitely going to stand out on the rounds, right, that morning, or just, when we're reviewing for the patient to come to the OR. So any of those scenarios. So very, very good. If they went for special studies, you could even accompany the patient on those studies. I did that a lot as a medical student, and then you learn about how the study is done too. So for those of you on the clinical rotations in the 3rd and 4th year, I recommend that, because then you'll see, how is a swallowing study done? How do they do that, right? Because, you're going to order these things, and then you want to really know how it's done. What does the patient encounter? So a lot of times, if you follow them just from admission, whatever they're going to all along, you can get the results first too, and then you're going to stand out on your rotation that way also. But it's also good for your knowledge to know what it entails, right? So how they go about it. your funded knowledge, this is really just a sit down book time. So for those in your first and second year, right? So hopefully, you know, you're studying and studying a lot, and you're going to get all this information. And that's how you're going to demonstrate that you know this basic clinical knowledge, is by, you know, studying in those first 2 years a lot, right? So if there's some medical problem that you don't know about, right, while you're on the clinical rotation, like I said, it's good to look it up. If they talk about, you know, the patient is having, you know, COPD, right, or hypertension, then you need to look that up if you don't know what it is, and then come back the next day and tell everything about it. If they're scheduled for an appendectomy, you should know everything about the procedure then too, right? If you don't, then you should look it up too, right? So a lot of things expected. And with time, you just kind of, as you look up more things, and it just kind of just all comes together, because you will have done it so many times. And then you can apply all that knowledge to the specific cases. But if you don't have the knowledge to begin with, that's a problem. That's just a sit down book time study. Some people have asked how they get this knowledge, right? So when you're studying for like your boards, there are various preps. I think the best thing to do is really do as many questions once you've done all the reading. So there's all different books. You guys can take your pick of them. You could do the Kaplan books, you could do first aid, you know, just try to do lots and lots of them. And then you have to know your learning style too. I think if you learn well in groups, then it's good to practice in groups. If you're like a, you know, individual kind of learner, and you're more of just focused on your own, then practice on your own. So over time, you'll kind of know what kind of a learner you are. Are you a visual learner? Do you need to see it and, you know, have it all, you know, planned out, you know, and so you actually see all the anatomy and have that way. So that's going to be up to you on how you study for the boards too. There's also various sites, you know, you can go to also, and then you can pay for all these things. But I think, you know, being in medical school, you're going to get this knowledge anyway. I really didn't do all these extra on top of it paying for it, because you're already studying anyway. But I know some people do that, so I'm not going to go through all those, but I know that they're out there, you know, on how to prepare for USMLE and for the COMLEX. So it's something to think about. I think, you know, really you should know your own learning style, and then I think you'll know which way you need to go for it. And then also very important to know is how to integrate and interpret data. So your history and physical, your lab studies, how to put that all together, right, for the patient. And as you go along in a rotation, so say you have a 12-week rotation in medicine or in surgery, you want to show growth in your knowledge, right, related to discussion of cases. So at the beginning of the rotation, if you talked about appendectomies, and then the end of the rotation they talk about it again, and, you know, in the beginning you didn't know too much, but if you can show that you know everything about it, you know, inside and out, then that's going to really make you stand out too. I think, you know, at your stage, no matter what, as a third year, fourth year, first or second year, you have to read every night. You need that sit down reading no matter what, even though it's hard, right? We all have lots of things going on in our lives. Some of you may be parents, some of you may have siblings, some of you may be living in your parents' houses, right? So you have your own parents, right? So, but you still, or you're on your own and you're with friends. So you have to see and just kind of block out that time, and, you know, every night I'm going to read for X number of hours, and then I'm going to do X number of questions. And I think you'll do fine doing it that way. A lot of people, as long as you put in the time, that's the important thing, because there's no way to just get it, right? You can't, it doesn't pop into your head, right? So you have to do that. Very important. I just want to see if I covered any of your other questions. Some people had also asked about some good resources on specific rotations. So depending on what you're doing, if you're doing like an ICU rotation, so The Marino book is very good. If you're doing like pulmonary, of course, you want to know the physiology, by West. If you want to do cardiology rotation, these are quick books to read. You still should read the bigger books. But if you wanted to do something beforehand, it's good to read these. You can read like Dubin for not a good person, but a good book. You could read that quickly in a night, even before you start the rotation, because you look at a lot of EKGs. So all these things are good to read beforehand if you can, if you have the time. I definitely recommend it, because that way you'll definitely stand out, because you've done it. Maybe the person you're working with didn't do it, right? So you'll have that. There's usually a few medical students right on the rotation together. For your case presentations, I'm sure you guys know who are third and fourth years already, but you want it to be organized. You want to delineate, the primary problem. You want to characterize it. You want to show a chronology of events, right, leading up to this day, right, Monday. What has happened? What is their history of present illness, right? So you also want to present with the differential diagnosis. What do you think this could be that, is occurring? Is it X? Is it Y? Is it Z, right? You want to have a focused physical exam. And then your presentation should be free flowing, right? So it shouldn't be all over the place choppy. So you want to keep that flowing, which is very, very good. And then when you go to your decision making, of course, the attending, the residents will be the primary decision makers, but you'll be there too. So you can tell us, what you're thinking. So, your funded knowledge is increased by reading, right? So the only way to tell us is you keep reading, right? So you have that information, right? And then if you can apply that funded knowledge to all the clinical situations, it's golden, right? And then you also want to develop and defend a differential diagnosis too. So if you can do all those things, you really, really will stand out. Those of you who like detective work, right? So medicine in a way is kind of similar in analogy to being a detective or solving a puzzle, right? So all these things fit together, right? So the history and the physical, the labs, the studies, the data, we're putting it all together to figure out what's going on. It's kind of also like the art of medicine too, right? Different way, we don't all come to the answer 1, 2, 3, right? You're putting it all together. And you also want to prioritize. And then hopefully you're helping us solve that clinical problem, right? For your H&P, I know some of you don't have access to electronic medical record, but you can keep your own written little notes if you don't. So you can have accurate recordings of the findings. You can make your own little problem list. I recommend having like a little notebook, and you can just put it in your white coat, your pocket, and then you can jot these things down. Or if you guys are with the phones, right? So you probably can jot it on notes in your phones, but I had like a little notebook, but that's old times. So you guys have the phones, jot it on your phones, right? Ability to expand the database, and incorporate the differential diagnosis is important, and patient management. You can use all these, computer, internet to look up things. Don't be afraid too. We have this technology, you might as well take advantage of it. It should be thorough and comprehensive. You should get the skills in interviewing the patient, over time. It's going to be not so easy. Those of you who, are starting out just after your second year, it's not going to be as easy as it looks, right? When everybody's doing it. So, but you'll get better with time as you do it. And identifying the problems, you'll get better with all that too. And also focusing, kind of gearing when you're talking to the patient, focusing on their key pertinent problems. Sometimes you're all over the place when you're talking to patients, but you can kind of steer them back in of where you need to be to get the information you need. And sometimes patients just need to talk too. Unfortunately, when we're in the quick situation for the OR, sometimes there's something that's on their mind, and you're the person that comes in, and that's, you're going to get, a lot of information. Sometimes that's extraneous, but sometimes they just need to say that. And I think if you can be a good listening ear, they're going to remember you too, and you'll get, you know, nice accolades. They'll say, you know, when the attending comes in, this medical student was wonderful, right? Because maybe all it took was, you know, they needed you to listen, right? And you were there, you were that ear to listen to. So if you can put the patient and the family at ease, you're going to have a very good rapport with, you know, the relationships and the families overall. You also want to appropriately communicate with the family any medical information. Some hospitals, you know, have ways that they go about this and only want the attendings to, or only want, so you should find out in each hospital you go to what their rules are for that. You also want to relate well with the difficult patients, even though those are sometimes the most challenging, right? So you have to really, really work in those situations. But if you can show empathy and compassion and respect, the patients will show that to you also, right? Just kind of like treat everybody how you would want to be treated, or how a family member, how one of your family members would want to be treated. Just think of it that way always. And then I kind of touched on being a team player before. So in the operating room, we really need that, right? So we're all working together. So, and it's like that even on the floor too, even though it doesn't seem that way, but sometimes, you know, it seems like everybody's doing their own little thing, but really, like everything in the hospital where you're working is interrelated, right? You have these teams, they're all meeting. You're dealing with nurses, you're dealing with aides. Believe it or not, like we're all taking care of the patient, right? So if you can start well with whoever you deal with, you're just going to have a much better experience. The nurses in the ICUs are so full of information. They have been doing this for years. So you could use them as a resource too, really. They can help you a lot, right? A lot of times in a lot of situations. You want to respect everyone's feelings, their wishes, rights of all. Kind of touched on that with the different cultures of patients. You may have people of different genders, gender orientation, so you should be respectful to all of this. This is important with any healthcare team sensitivity, all very, very important in anything you do. And then with your colleagues, you know, the relationship you have with them, it all starts on that day one. We always get that first impression. So if you come late, then you know that, oh, they're like, oh, this person is not giving good attendance, right? They're not dependable, they're not here on time. So if you start early and you're always there, shows you're punctual, you're dependable. You have a rotation, you have limited days that you're there. So you should be there for them, right? You want to be a part of the team, and you want to have the good patient care responsibilities. And some things just to keep in mind also, as you're going along in the rotations, it's definitely good to get letters of recommendation, right? You want to get that early on. And don't be afraid to ask for the chair letters, for the department letters, because if you're going into a certain field, you need that. The chairs are going to be the well-known people. Even if you may not have worked with them, it's good to ask for it. You also want to solicit any criticism with interest and grace, right? So maybe you didn't have such a good day that day, right? But if you can find out what you can do better on that day, it's going to make you look better in the long run too. You also want to show change. Be self-motivated, ask what you can do, right, to get better, expand your knowledge, make an effort, you know, to learn all the patient's problems, and then show your effort to the attending, to the residents you work with. Sometimes the residents can evaluate you too, depending on the rotations. So you might have residents and attending evaluations, depending on where you are. And then show off all that reading from the night before. Really, really good to do that. You worked hard reading it, so you might as well. If you know you read all about pediatric, emergencies, then come in that next day when you're in the pediatric ER and talk about all of them, right? Somehow work it in, right, to show that you know it. And then, like I said, your evaluations, you should get them from everyone while we have it fresh in our mind. So don't wait until months later, because we're all getting older, right? We can't remember. So if you come back to us 6 months later, you know, I encounter so many students. It's very, very hard to remember who I had, you know, on, you know, 2020 last year, right? So it's good if you get it right on that rotation before you leave the rotation is what I highly recommend. Just want to see if I touched on anything else. Somebody also asked, what can you do to make your CV stand out, right? So volunteer activities are very good when you're in your first and second year. If you are on any of the medical student groups and you're leaders in it, that is definitely a great thing to do. Anything that you volunteer in your community is wonderful. You could put on your CV. If you're doing any research, right? So we have FAIR. I think I had mentioned it to some of the students before, which is the Foundation of Anesthesia and Education Research. You can apply to do that research and you can go anywhere in the United States. So it's faer.org. And then with that, that looks fabulous. And sometimes you can get a write-up too when we had in-person meetings, which are coming back to in-person meetings. So you could present that at the in-person meeting and you can have something that's written up in a journal, which is amazing to get as a medical student. So that makes you stand out. It doesn't have to necessarily be in anesthesia either. It could be in any of the fields. Also, if you teach other students, a lot of people do one-on-one teaching to other medical students, right? So that looks very, very good also. And then any of the group leader activities, like I mentioned, all of the medical schools have clubs or groups. So I highly recommend getting involved with them. Those of you who are first years, you can get very involved. And then as second years, you could be leaders. The ones who are third and fourth years, you're already out, you know, from the medical school, right? So you're already working on your clinical rotation. So at this point, you can try to write up some of the interesting cases you've seen. If you have interesting cases, you can get those written up as case studies, pair off with a resident or an attending who's on the rotation with you, and then submit it to journals. It's a lot of work. I've done it. I did it as a medical student. I've done it, you know, as an attending and as a resident. It is a lot of work, but it's worthwhile in the long run. And it definitely makes you stand out because not everybody does it. So, and you'll learn through the process too. It's an interesting process of just getting your, you know, your own paper published also. And then if you get to present it at a meeting, that's just a big plus. We also have resident submissions for AOCA. So if any of you, you know, in your first and second year, down the road, not necessarily this meeting coming up, but you see something next year and you want to submit it, you can also do it as a poster for AOCA and present it at our meeting too. So any of the meetings, the ASA, AOCA, you're really, really on top of things if you can get a poster presented at a national meeting. That is wonderful as a student. Just seeing if I hit on all your questions that were sent in before. Some of the skills we talked about, right? I told you before, you don't have to worry. You're not going to come in with the skills immediately. You're going to learn that on rotation. So people were asking, what skills will you need before? You're going to learn as you go, right? So it's truly the see one, do one, teach one, right? So you first see it as a student, and then you do one, and then you're going to be able to teach it, right? So it really is in that aspect. We do have a lot of simulators now done also, but it still is the see one, do one, teach one. You'll see when you're out on the clinical rotations. And then for an elective rotation, like for anesthesiology, some of the books that you could read beforehand, we use Baby Miller, where I am. So that's a great book. It's small, it can be read beforehand. It is a good, concise amount of information. It is a lot though if you're just coming for like a 1 week or a 2 week rotation. But if you're coming for a month, I definitely highly recommend reading all of it if you can read it before. I'm gonna open up the floor to questions. Oh, late question. What are the pros and cons of rotating at community hospitals versus larger academic centers? So, so I've been at both. I did a private practice. you know, the community hospitals, you'll see more of the bread and butter cases, but you can have big emergency cases. There's less teaching, right? So also you're kind of working at on your own in private practice. When you're in a teaching hospital, it's very nice. I teach the students, I teach the residents, I teach the anesthesia techs. I have all the, you know, the ancillary areas too that we also teach, which is very nice. We have PA students, we have student nurse anesthetist rotating through with us. So we teach all of these people, which is wonderful. You don't really, I didn't have that in private practice. I was just kind of just working with myself, the surgeon, the nurse in the room. So very different. So it depends on what you're looking for. And how, I think those are decisions, you know, that are for later on, but great to ask them as a student. And then how can we make the most of our rotations when rotating at academic centers? So when you're rotating at an academic center, it really, like I said, always introduce yourself, be ready, put on your gloves, be ready, raring to go, right? So you have so much available to you in the academic centers. There's pretty much lectures every day, right? So if you don't know how they're accessed right now, everything is virtual. Whatever department you're working with, ask to get the schedule, ask to get the Zoom info, the Teams info to be put on that list. So you can go to those lectures, because unfortunately we're still all virtual where I am, but you want to attend them. So as a student, you should be able to. And then how can we make the most academic centers with residency programs is not an option. If you don't have a residency program there, you can still learn from the other departments that may have an overlap. So if you're interested in anesthesiology, it's nice to do a cardiology rotation. It's nice to do, you know, because you'll see a lot of EKGs, that will come in handy. Nice to do pulmonary, because, you know, we need to know the lung physiology. But if you can do outside rotations at other places that do have it, then I highly recommend that too, if your medical school will allow it. And then how does an osteopathic education help students that are looking to become anesthesiologists? I think we're very lucky as osteopathic, you know, all of us who have an osteopathic background, right? So we're very hands-on. You guys are really, because you're doing your palpatory skills on each other from day one, so you're not afraid to touch patients. For a lot of pain procedures, you know, we actually can use a lot of our palpation. You'll see a lot of that. It's interesting because we have the trigger points that we do for pain procedures, but in osteopathic medicine, we call that tender points. It's very similar, some of the things, so you can see it kind of keyed in for anesthesiology that way. Depending on what you go into, what subspecialty, we have various subspecialties with anesthesiology, so that's just one of them, you know, being pain medicine. And then how can we stand out on any away rotations? So I think kind of what I said, like all these things, know your patient before, right? When you come in, you're kind of always on when you're on the away rotations, right? So here you want to impress them. You apparently wanted to go there, right? If you pick this location to do your away rotation, right? So it's kind of like an audition, right? So while you're there, so you want to be punctual, you want to be early, go in with the resident when they're setting up their room, right? Networking with the attendings right there, right? They're going to remember you, right? Because they're the ones who are writing the evaluations and making the suggestion if you're going to come to that program, right? They're going to put in their recommendation that way. So all these things are very important. If you have lectures, you know, be at them. I would say, you know, we have scheduled lectures, so a lot of rotations do that, where you have scheduled lectures, and it doesn't look good when they take an attendance list and then you're not there for the lecture, right? So you really need to be there, because we take an attendance list every day, so we know who's you know, there and who hasn't shown up. And then ask good questions, right? So a lot of times people don't ask as many questions, so then it's like, oh, they know everything, right? But maybe, you know, you have that burning question. There's no bad question, right? So it's good to ask it if you have that question, right? And then everybody else can learn from it too. just looking at anything else. Somebody asked about, well, how can you stand out on CCU? So like a critical care rotation, same idea, you're going to be rounding, right, on these ICU patients. So you want to know all the information inside and out with them. I'm going to open it up if you have any questions from the floor also. You could unmute yourselves, I believe. Lily can ask to maybe unmute everybody because everybody I see is muted.
Yes, and everyone should have the ability to unmute themselves. Okay. So don't be shy if you have a question for Dr. Landman. We have just a couple more minutes. She is clearly, you know, one of our best resources at the student level. So feel free to unmute yourself and ask away.
Dr. Landman, kind of on that note of aways and auditions. So I have an audition coming up in anesthesia. So you mentioned Baby Miller. I wanted to know if you had any other recommendations for how to show up so that I'm prepared specifically for an anesthesia audition.
Okay, yeah. You're going to get, usually they give you reading assignments while you're on the rotation too. So so I would just start with that, and then, you know, you can go from whatever they're going to assign you on your rotation too. Each place is going to be a little different on what books they use, on what they're expecting of you. But I think if you come in with some knowledge already, right, then you're already starting at a higher level than somebody who, you know, hasn't even done that. It's just going to make you look that much better, right? So anything you can read beforehand is always helpful.
Awesome, thank you.
You're welcome. Anybody else have any other questions or comments? I wanted to make sure I touched on everybody's questions that were sent in too.
While we're waiting for any last minute questions for today, I did just want to remind everyone that has joined us today that we are going to be hosting additional student opportunities. So we will follow up with an email about the recording of this session. In addition to our other two, we had some representation from a couple different residency programs on our last two meetups. So I'll go ahead and give you all those links as well, so you can learn a little bit about those programs. And the best way to stay in touch with AOCA and know what is going on is to be a student member of the college. It is a complimentary membership, so you know, there is no fee at the student level. But that's the best way to stay in touch with us. Also follow us on social media, LinkedIn, Facebook, and Instagram. We try and post all of our engagement opportunities through those channels. And in the late fall, we will be opening up the call for volunteers for our committees. We do take student representation on all of our committees. The membership committee, the one that Dr. Landman chairs, has quite a few different student members on it now. So again, in the late fall, probably October, November is when we'll start sharing that call for volunteers. But they're national committees. So if you submit an interest and are selected to serve on that committee, that looks really good on your CV, especially going into residency. So we do consider students. I just want to make sure everyone on here knew that.